like to introduce them all to you. First we have Esther, we have Emily, we have Carly, we have Rachel, we have Maddie, we have Esmeralda, we have Tessa, we have Grant, we have Sean, we have Ella, and we have Rose, and we have Xander.
Our case study was number 5. Our patient was a 68-year-old male who complained of a persistent hoarseness. He contracted a cold about 3 months ago, and then he noticed his voice changing. He sings in a local choir and can no longer hit the notes that he could before. He occasionally feels like something is stuck in his throat.
So a little bit about the patient, 68 years old, male. He came in on 7/16 this year, complaining of stuff in his throat. Okay, the history of present illness is basically we asked him a bunch of questions, and the characteristics of his pain were that it was a throbbing in his throat. The onset is basically what brought it on, which was the cold. The location was up the throat and the left side of the lymph node. The duration, it was constant throughout the 3 months. The exacerbation was what makes the pain worse, which was eating and swallowing. The radiation, it was only in the throat, it didn't spread anywhere else. The relief was when he wasn't eating or swallowing, and the associated symptoms, he had unexplained weight loss of 10 pounds. The past medical and family social history, he has no allergies, no illnesses, no surgeries of any kind. He is a heavy smoker. He smokes 1 pack a day. He was really tired, and since he sings in the choir, he can't sing anymore because it hurts. His father was a fast smoker. He has no drinking problems or breathing problems.
Alright, after we ran the head assessment, we came out that our patient was generally healthy until 3 months ago when he acquired a cold. He's been retired, and he has been smoking for 4 years. He's also an occasional drinker. Review of systems from head to toe. We found out that he generally had the unexplained weight loss. He had the past cold, but he has not showed any fevers in the past 3 months. In the throat, he has pain swallowing, and his voice is very hoarse. For the lymph nodes, he has 1 swollen lymph node on the left side. It's very painful. The GI or gastrointestinal tract is unaffected. Normal bowel movements, they're always regular. Other than that, his eyes, ears, head, respiratory, and cardiac are all unaffected.
Okay, so moving on to the patient exam. He has a temperature of 98.6, his pulse is 60, respiratory rate 22, and his blood pressure is 124/72, so it's pretty much all normal. In general, he's tired and lethargic, as well as having a swollen left lymph node. He has palpable swelling in the middle of his throat, and additionally, he has poor dental health, but no masses in oral cavity.
So our differential diagnoses, the initial diagnosis came up with lung cancer, vocal polyps, laryngitis, throat cancer, an upper respiratory infection, and strep throat. We ran a strep test and it came back negative, so we were able to eliminate strep throat. He doesn't present any symptoms of an upper respiratory infection or laryngitis. We know it's not lung cancer because he's having no symptoms or pain in the lungs. And we also know it's not vocal polyps because we did a laryngoscopy, which is taking a visual of the throat using a small camera. And there were no small masses present on the throat. Instead, it was a large singular mass. So we decided that it was a type of laryngeal cancer. Now, the 2 types of laryngeal cancer that there are adenocarcinoma, which is a cancer of the glandular cells of the larynx, and squamous cell carcinoma, which is on the epithelial surface cells of the larynx. The laryngoscopy revealed that the mass was on the surface, so we were able to determine that it is squamous cell carcinoma.
Yeah, so these are the steps that we were going to take into figure out the diagnosis. We are going to design the aspiration to go straight to the biopsy because that will give us the best results. After that, we can do a complete blood count and comprehensive knowledge. So there may be a few precancerous cells, a little bit of abnormality in the cells, and this can be found very easily through a typical swab. It hasn't penetrated any of the membranes of the cells or radiated or spread out anywhere in the throat or the region that has been infected, and this is referred to as T stage 0 or TIS. And in the second stage, T stage 1, this is when the cancer has begun to spread. It may affect one of the vocal cords. They may not be able to move as well as they usually do. And in the third stage, T stage 2, this means that the cancer has spread out to the glottis or above the vocal cord, the supraglottis, or beneath it, the subglottis. And it has began to radiate around that region, but it hasn't spread out further out in the throat. And in the fourth stage, we call this locally advanced laryngeal cancer. And this is when the cancer has begun to radiate across the region that has been infected. One of the vocal cords may not be able to move at all anymore, or both of them actually. And in the final stage, stage 5 or T stage 4A and 4B, this is when the cancer has radiated throughout the surrounding region. It can infect the trachea, the esophagus, any region in the throat, and it's on the surface of the tissue.
Okay, so once looking over all the stages possible, we can decide that our squamous cell carcinoma is stage 3. The name for that is T2N1MO, which basically stands for T2 means there's 2 infected regions. We have the infected larynx, which is where the cancer is located. We also have the infected lymph node, which is the left one. N1 stands for nodes or lymph nodes, and that's the left node. We have 1 of them infected, possibility of 2, the one on the right side as well. And N stands for metastasization, and from our tests, we show no signs of metastasization.
Okay, so once the diagnosis was complete and we had to figure out which stage it was, the next step was to figure out a treatment plan.
One possible treatment was radiation therapy, which uses X-rays or other types of radiation to kill cancer cells. There are 2 types, external and internal irradiation. External radiation therapy uses a machine outside the body to send radiation towards the cancer. Internal radiation uses radioactive substances to place the substances directly in or around the cancer.
Another option would be chemotherapy. Chemotherapy uses drugs to stop the growth of cancer cells. The chemo can either be administered directly to the bloodstream where it will affect the entire body, or it can get administered directly in the region so it's localized in that area.
We could also use clinical trials such as radiosensitizers, which are drugs that make the cancer cells more receptive to radiation therapy to make it more effective in killing cancer cells.
Another clinical trial option would be chemoprevention, which uses drugs or vitamins or other substances to stop new cancers from forming or stop the cancer from coming back once it's treated.
Now, the treatment of laryngeal cancer depends on the stage of the cancer and its location. In our case, in stage 3 of the glottis and supraglottis, we could use chemotherapy and radiation therapy together. Radiation therapy alone for patients that cannot undergo chemotherapy or surgery. Or we could use clinical trials of radiosensitizers and chemoprevention.
Okay, so there are 3 main surgical options for the squamous cell carcinoma. Now, if the tumor is small in the throat, then we use a endoscopic resection, take a small portion of the tumor out and move it through the mouth. There's also a hemilaryngectomy, which is just taking half of the larynx out. People who go on this can talk, but very quietly. There's also a total laryngectomy, which just take the whole larynx out. People who go this cannot talk at all.
So as far as getting other people involved in the treatment and everything, there's 3 main sources. There's family, a surgeon or a doctor, and then aftercare therapy. So as family to the patient that's diagnosed with the cancer, they can provide support and care for when the patient gets home. If they can't do anything on their own, they can be there for them.
So inherited genes do not always cause the cancer, but it will make us have reduced ability to detoxify carcinogens. And carcinogens are the main cause because they will damage the DNA. So the genes, carcinogen genes, are the ones that will grow and divide the cells. And so those will get out of control because they turn off the tumor suppressors, which will cause them to die. And so that's how cancers kind of get out of control more. And the main ones for laryngeal cancers are TP53 and P16. And the laryngeal cancers are more common than in females.
So specifically how the cancer is going to work, we want to determine the onset, and that often helps in the treatment of the patient. So in this case, our patient was a smoker. He smoked a pack a day for about 40 years. So the carcinogens within the cigarette smoke are going to damage the epithelial lining within the larynx, causing the cells to mutate. The carcinogens also dampen the immune response, therefore allowing more tumors to grow or more cells to divide more rapidly. Fortunately for our patient, the effects are reversible. So long as we remove the carcinogens and keep him from smoking, the epithelial cells will begin to heal. You just have to remove the tumor and all infected regions.
All right, on the immune response level, cellular level, we have leukocytes or white blood cells. For tumors specifically, you're gonna have natural killer cells. These are non-specific cells, so they don't actually target things with antigens, they just target cells that we provide typically. White blood cells like basophils aren't actually used in this because those are specific. But once the natural killer cell finds tumor cells, it will inject enzymes, kill it, and then it release cytotoxins to attract monocytes and macrophages, which are cleanup cells. They come along and break tumor cells back down into regular proteins.
So we're just gonna ask like a few 4 questions, see if you're paying attention, and then there will be like a prize for it. So the first question is, name the components of a soap mill. Anyone knows it? It's not that big. What do they stand for? S-O-A-P.
Come on, who can tell them?
All right.
Somebody raise your hand.
I know one of you in the audience ought to be able to say this.
Come on, guys, you get Jolly Ranchers.
It was in the patient interview that Miss Autumn and I gave.
Seniors know?
Really, that's
Okay, well, it was,
Freshman.
Someone was taking that shot.
I like it, the pop quiz.
So the second question is, what was one of the diagnostic tests or that we ruled out? Like that we ruled out.
Now you guys are participating in the Jolly Ranchers.
you rule out. Okay, third question, what stage was the cancer?
Justin. Ah, nice.
There's 8, I'm not gonna do it.
Okay, so the last question, is this cancer more prevalent in males or females?
What about you in the back?
Nails.
Oh, nice.
Do you mind coming down?
Yeah.
Come and get your prize.
Well, again, thank